Hello friends, I am Dr. Anubhav Gupta. I am a consultant plastic surgeon working at Sir Gangaram Hospital. Today I am going to talk about a very common topic, which is facial injury. Now this is something which we see very commonly in our day-to-day life. Face is comprising of a lot of structures. There is skin, there is subcutaneous tissue, then there is muscle and there is bone underneath it. So when we talk about facial injuries, we can divide them broadly into two types. One is the simple injuries and one is the complex facial injuries. Now the simple injuries are the ones which we see like our kids, they fall in the house and they have cuts and they have contused lacerated wounds. And the complex injuries are usually seen when there are road traffic accidents and there are deep cuts right up to the muscle and there are fractures of these bones. So these are the two common types of injuries related to face. Now the question next which comes to our mind is what to do. So in simple facial injuries, what needs to be done is that whenever such injury happens, you need to apply some pressure on that so that the bleeding stops. And if you are concerned about good scars and better looking sutured wounds, then you should consult a plastic surgeon to get it sutured. And in any case, it has to be repaired, it has to be stitched. So that is the management of simple injuries. But complex injuries they require a more advanced management, wherein you not only a plastic surgeon but a neurosurgeon and other people are also involved, because these injuries usually are not isolated injuries. They occur with head injury also. Many times there are injury to other parts of the body, so it's always better to take the patient to a better hospital. So in these injuries, what we usually do is, once the patient is stabilized, these injuries require, for example, a fracture requires fixation. Now fixation means, just like there's a fracture of the hand or the limb, there is plating and screws and slabs and plasters, all these things. The principles are similar for facial injuries also. So we use very fine titanium plates for fractures. The commonly fractured parts are the upper maxilla or the lower maxilla or the mandible. So what we do is, the importance in such facial injuries, there are two priorities. One is that the patient should be able to eat even after these injuries, fractures, because once these bones are fractured, it becomes very difficult to eat. So the priorities are that the patient should be able to eat normally even after the injuries. And the second thing is the lower part of the eye. So there should be no problem in the vision as well as the cosmetic outcome. So these bones are to be put back together anatomically by plating and fixation, so that the patient can lead a normal life vis-a-vis having a normal vision, being able to eat properly. So these are the principles which are required for fracture fixation and complex injuries. Now, to know more about these types of injuries, you can get in touch with me on Lybrate. Thank you.